as we moved through 2020, our world was transformed by the spread of a virus. Towns and cities around the globe fell silent as we were told to stay at home. Both the COVID-19 pandemic and corresponding measures to contain it are unparalleled in modern times, impacting everything from public health to the environment. During the months of March and April 2020, we became witnesses to the largest unintended air quality experiment in history. And what we saw around the world is that lockdown measures not only reduced virus transmission, but we also saw air pollution decline sharply.
Show a drop in air pollution across the country.
This is significant because air pollution is the single largest environmental health risk globally, causing strokes, heart disease, cancer and respiratory diseases, accounting for an estimated 7 million deaths per year. COVID-19 is an unfolding tragedy, but it's given us this extraordinary insight into how the ways we get around, work and consume affect the air we breathe. The world's response to this pandemic demonstrates the dramatic efforts that can be taken to protect public health. But up until now, air pollution has largely been ignored. But could this be about to change? Air pollution is an ever-present problem around the world. And in the wake of the coronavirus pandemic, there's been renewed focus on this issue.
COVID-19 is still so new that scientists are learning more about it all the time. And 2 studies published this month are looking at the link with air pollution.
These early studies suggest that people who live with higher levels of polluted air are more susceptible to the virus. Some studies have even suggested that viral transmission may be increased as a result of the virus attaching itself to airborne pollutants. However, it's still early days for these studies, and it may be some time before we have a clear picture of what this means. But it is important to remember that even before COVID-19, over 1,300 premature deaths were attributed to poor air quality every year here in Ireland. Of the different types of air pollution, some of the most damaging are tiny particles that not only damage the lungs themselves, but are able to enter the bloodstream. The largest source of these deadly particles comes from burning fossil fuels for home heating. And throughout the pandemic, the Environmental Protection Agency recorded some of the highest levels of these particles in smaller towns across the country.
All across Ireland, both in our larger cities and also in some of our smaller towns, with some of the highest values being recorded in some of those smaller towns, again due to reliance on solid fuel heating systems.
The impact of lockdowns on air pollution levels is a complex one, and one we're just beginning to understand. But when it comes to the harmful air pollutant nitrogen dioxide, Ireland did follow the global trend and saw a significant drop in the concentration levels.
They did greatly reduce when it came to the traffic-derived pollutant nitrogen dioxide, and that link really was very, very clear to see. And then from the point in time that lockdown started to be eased, we unfortunately looked to see and started to see those levels start to rise again.
The combustion engine is the main producer of nitrogen dioxide, an air pollutant that not only forms particles, but also causes a toxic gas.
It's diesel-powered and petrol-powered vehicles, with diesel vehicles contributing more NO2 than petrol-powered vehicles.
A little over a decade ago, diesel vehicles were promoted by governments and the car industry as a cheaper alternative to save the planet. Challenged to reduce carbon emissions, governments used tax incentives to encourage citizens to switch to diesel, which were thought to emit less CO2 than their petrol equivalent. Here in Ireland, we really fell head over heels for diesel vehicles, and diesel sales soared. Car makers spent millions promoting diesel as a more environmentally friendly car choice.
It is really, they tried to expand their diesel sales. And so they had a whole marketing story around clean diesel, as they called it.
But as driving a diesel was being pushed as a cost-effective way of doing your bit to save the planet, slowly at first, evidence started to emerge of harmful health impacts associated with diesel emissions.
Brussels has agreed that cars should undergo real driving emissions tests.
The European Environmental Agency found that in a single year, nitrogen dioxide from diesel fumes had caused over 70,000 premature deaths across the continent.
Are demanding action in this area.
The World Health Organization labelled diesel exhaust fumes as carcinogenic, putting them in the same category as things like asbestos and mustard gas. Then, in 2015, came Dieselgate.
Our company was dishonest. And in my German words, we have totally screwed up. The CEO of our parent company, Dr. Martin Winterkorn, said yesterday, he stated that he was personally and deeply sorry for this.
In today's cars, there's a mix of different pollutants. But here, what really Dieselgate was about and is about is nitrogen dioxide, which is harmful. It can irritate your lungs, it creates asthma, it can create all kinds of health problems. Volkswagen boldly said in the US, we've solved that problem. Now our diesels are super clean, but they weren't.
We're saying the cars were clean, but they weren't. How were they doing this?
In a laboratory where the cars were tested, until recently only, you're driving on something like a rolling motorway, basically, and you're not turning the steering wheel, for example, because you're just going straight. And the software, in different ways, different manufacturers had different softwares, they recognized what was happening. They said, I'm being tested. So I switched on all the technology on board to turn down emissions. But when you're driving the car on the road, often it was 10 times, sometimes 40 times more polluting than in the laboratory. So you can imagine that this is not why we created cleaner laws, to just make them cleaner in the lab. We wanted them to be clean on the road. But still, there's companies like Volkswagen that ignored this, and that's why they were sued and eventually also fined by governments and courts. But clearly, this had been going on for a while. And we as Transport Environment, we also looked at the whole fleet of these dirty cars on the road. Our latest figure from last year is that we had 51 million cars in the European Union on the road that were really far above the limits, so 3 times above the limits when driven on the road. So it's a big thing. It's been going on for a while indeed.
So over 50 million cars driving around the streets of Europe, badly affecting people's health, above the limits, and they were just getting away with it.
In the end, it unfortunately took a big international scandal, one of the biggest in history, to fix this. Now we're getting into a position where things are improving, but we still remain cautious whether really we get the cleaner air that we're all hoping for.
Despite Dieselgate, the growth of diesel vehicles continues here in Ireland, accounting for over 60% of vehicles on our roads. This increase raises concerns about the health implications of higher nitrogen dioxide emissions from these diesel vehicles, particularly in urban areas. So is this being seen on the National Air Quality Monitoring Network?
This is one of the 84 monitoring stations that we have all across Ireland, and it's monitoring in real time. That traffic-derived pollutant, nitrogen dioxide, has led this station to give us an exceedance of the EU limit value for nitrogen dioxide. So this is also an exceedance of the World Health Organization's guideline value.
And how are you actually monitoring it? What happens inside this machine?
This head here is linking through to an instrument that's monitoring the nitrogen dioxide, and this one here is linking through to an instrument that's monitoring those very, very fine dust particles. Then those instruments are connected through to our network, and ultimately you can get the real-time data from this station on your smartphone.
And what is the plan going forward for the number of monitoring stations you have?
Well, since 2017, we have launched the National Ambient Air Quality Monitoring Programme in order to convert this information and data from the stations into the readily understandable format of the Air Quality Index for Health.
The EPA's Air Quality Index data was recently used by the HSE to examine the relationship between poor air quality and hospital admissions in the Greater Dublin area. Dr. Ian Quintine from the Department of Public Health is the lead author on the study, and I'm here to find out if he has seen measurable effects on health outcomes.
Ian, do you want to tell us a little bit about the research that you published recently?
Yeah. So in collaboration with my colleagues in the Environmental Protection Agency, we took a look at the performance of the Ambient Air Quality Index for Health. So we took a look at 4 years of data, and there is an established link between certain cardiovascular and respiratory illnesses. So asthma, chronic obstructive airway disease, atrial fibrillation, heart failure, and myocardial infarctions. So what we did was we took a look at those patterns of admissions and correlated it to the Air Quality Index for Health.
So you're looking to see whether the air quality on a certain day is, say, good, poor, very poor, and you're then measuring that against the number of people that have to go into hospital.
Yes.
Okay, and so tell me a bit about what you found.
So here we have the respiratory admissions in Dublin for 2014 to 2018. As you can see, there are definite patterns in terms of increases in the respiratory admissions. And then we can overlay them with the Air Quality Index for Health. So when we overlay those together, and you can definitely see that when the air quality in Dublin is fair and poor, that there's a rise in the respiratory admissions, and that continues, and that pattern is seen over the 4 years.
That is very, very clear, very striking, to be honest, information. You can really see the air quality there in Dublin, and directly, I mean, the same day it looks like people are going into hospital with respiratory illnesses.
Yeah.
And are you seeing it the same day?
Yeah, they are seeing it the same day, basically.
When there's air quality that is poor in Dublin, people are going into hospital.
Yeah, particularly for like asthma admissions, there's a 70% rise in the admission rate the same day, 60% rise the day after, and 50% rise the day after that. So they are definitely knock-on impacts.
And it's not like this happened once, Ian. I mean, we can see this is a repeated cycle over and over again.
Yeah, you're correct there.
And you're saying asthma, which means, I presume, largely children.
Yeah, so it's certainly something that has a greater impact on the younger.
So it's really been shown that air pollution can affect you continuously throughout your life. So it's not just these individual admissions, this is an ongoing problem.
You can have a lifelong impact with respect to exposure to poor air quality, and it can lead or lend to a reduction in your overall life expectancy. You should try to say this to reassure you. 96 out of 100 days, basically, the air quality in Dublin is good. 4 out of 100 days, it's not so good. And on those days, in particular, people with certain cardiovascular and respiratory illnesses, so particularly people with stuff like asthma, those individuals are at increased risk. If they go outside, they play, they undergo the regular routine activities, they stand a greater chance of having a less favourable outcome in terms of them go to hospital for admission.
Many studies have investigated the health risks of poor air quality and found consistent association between an increase in the frequency and severity of respiratory conditions such as asthma, COPD and lung cancer, with increased levels of pollutants in the air. Dr. Quintine's study reveals for the first time in Ireland the direct impact that poor air quality is having on our health. Air pollution is associated with a wide range of health effects. But if we look just at asthma, for instance, Ireland has one of the highest prevalences in the world. Every year, there are over 8,000 asthma-related admissions to our hospitals. It can be difficult sometimes to look through these data sets to see that it's real people behind these numbers. So to get an idea of what it's like to live with asthma, I've come to North County Dublin to ask 10-year-old Ingrid McLaughlin. Ingrid is one of the 450,000 people across Ireland who suffer from asthma.
Tell me a little bit about your asthma. Have you had it all your life?
I had it when I was about 6.
Okay, right. And what happened the first time you had it? Do you remember?
My chest would start hurting, and then I felt like a big rock was on my chest.
Oh, did you have to go to a doctor?
Every time we went to the doctor, they'd just say, like, rush to the hospital.
What was that like?
It was a bit scary for the first time.
Basically, when we got into the hospital, she was like lifeless, basically, and I brought her in, and they rushed her through to the, I think it's a resus it's called, and they had said that the oxygen was way down in her blood, and it was just.
What age was she at the time?
She was 5.
Do you remember any of that going in?
No.
Yeah. It's scary for mums, though. It's scary for kids as well, but do you have a bit of medicine that you take for your asthma?
Yeah.
Do you want to show me how you do it?
Well, I have this baser and I also have an inhaler, and then you go like this and you press it 2 times or something, and this one if you have a good bit of severe asthma maybe, and maybe if your chest feels a bit sore or heavy.
And how many times would you say she's had to go into hospital with this?
I think we counted, I think there was 17 times in the space of 2 years.
Was there any way to predict when that was going to happen? Or is it just...
I remember one time we were just out in a day in the park, and another time I think we were in the zoo, and other times she might be coming home from school.
One of the things that we kind of know now and is coming to light is that air pollution from cars is causing little kids to, sometimes develop asthma and sometimes have their asthma worsening. I was just wondering what would be a good way to get rid of that pollution, though.
Maybe I'd like people to not spread so much kind of smoke and of car engines, and maybe just kind of walk instead, or just get some exercise.
Get some exercise, exactly. And that's good for them as well anyway,
yeah.
Isn't it? As awareness of air pollution and its effects, particularly on children, grows, so too does the pressure to come up with an effective response. But what can be done about it? Exposure to traffic-related air pollution has been linked to a variety of health effects. And we know that children's developing bodies are uniquely vulnerable. Exposure while at school is a growing concern because many schools, more often than not, are located beside major roads. Air pollution monitoring at the point of exposure is an effective way to understand the risks. And that's just what the students at Larkin Community College in Dublin are doing.
So today we're setting up tubes during the school and collect data about our air qualities. We have three places where we have the tubes. We have our drop-off zone, our sheltered zone, and our traffic zone.
Tell me, why do you think it's important to monitor air quality at all?
We're trying to spread awareness.
They're participating in a program called GLOBE, which is a NASA-sponsored international citizen science project to monitor air quality, overseen by Antashka and the EPA.
And essentially it's a program designed for students to bring them out into their local communities and conduct real science.
So it's not just practicing science. These children in secondary schools are doing real scientific experiments.
Yeah, well, definitely we're trying to get them out of the lab, really, and away from the old Bunsen burner. A major project that they're involved in at the moment is looking at air quality, and particularly pollution associated with traffic. And the principal pollutant there they're looking at is nitrogen dioxide.
So what's been revealed by this study?
Pavel, tell me a little bit about what it is that you're measuring.
We're measuring nitrogen dioxide. We keep them up for like a month around so, and we send them to the lab for them to measure, and they give us back the results.
So Alicia, is that why you're putting them in 3 different places?
Yeah, so you can track like which area is worse, which one's better.
What do you expect to see?
Well, we've actually been doing it for a couple of years now. This is our 4th year, and we're still going to keep on going.
And in those previous years, did you ever see them go above the safe level of what's allowed?
Yeah, it's crazy, yeah.
You have to cross this road where it's like 45.
So at some stage last year, the air quality in this area, that exceeded the limits of what you're allowed to have.
Yeah,
and
by
this is where you go to school.
Any amount of level is still pretty bad, but just the fact that it's above the recommend, like the safe level, it's really concerning.
There shouldn't be like a regular amount of nitrogen dioxide. It should stay at 0.
What do you want to see happen with all this data you've collected?
So I hope that people will be more aware of how their actions can affect others.
Yeah, that's the most important thing, getting people to like realize what's happening.
Teaching young people about air pollution helps them to realise that the environment is central to life and health. But it's easy to understand the frustration these students feel when they see elevated levels of air pollution around their school, especially since there's little they can do to improve it. There's a proposal from government to ban the sale of new petrol and diesel vehicles by 2030. However, even if this proposal is implemented on time, with an estimated 1.7 million diesel vehicles currently on Ireland's roads, this lethal legacy will continue to aggravate all our health for some time to come. So is there anything that could be done to bridge the gap and improve the situation now? A sort of living with dirty diesel plan. Fingal County Council has introduced the School Streets Initiative to improve the safety and well-being of school children.
Why did you do this in the first place?
Yeah, there was a lot of issues here in terms of congestion. When kids were getting dropped off, as I said, there's over 900 kids in the school, so there was a lot of movement between vehicles, pedestrians on footpaths, stepping out between cars parking on footpaths, cars double parking and trying to get around each other. So there was an awful lot of conflict. It's an issue around all of the schools.
Every school day, morning and afternoon, sections of the road outside St Oliver Plunkett School in Malahide are closed to traffic. Parents have the option to park and stride at a local car park or use stop and drop at the edge of this car-free zone. So, is the scheme a success?
So what kind of benefits, other than the reduction in traffic, are you actually seeing now?
So we're seeing huge benefits in air quality. We've got a 20% reduction in the nitrogen dioxide levels and particulate matter levels. So that's a huge benefit in terms of the air quality that's directly outside of the school.
So you've actually studied the air quality in this area since you brought in this initiative?
Yeah, so we had an air quality monitor sitting at the end of the street here, still in a zone that was trafficable. So it would be measuring both the change in activity that was happening and the resulting effect on the air quality. So we're confident the results are showing significant changes in air quality.
Tell me why the road is closed.
I think it's because of the safety, because when kids come up, they just have to walk into the school without a car hitting them.
Okay, so that's safety. Who thinks that's really important here? Hands up over here.
The air is getting fresher because the cars aren't burning any diesel or petrol. We need to stop driving places that we can easily walk.
Tell me, what did Mum and Dad think of that? Were they a bit annoyed at first?
Well, they were a little bit annoyed, but then after it was fine. My mum and dad were a little bit annoyed at the start because they had to drive to work and it caused a little bit more traffic, but then they realised that it was much safer.
Do you guys think that every school should do this?
Yeah.
Yeah, absolutely.
In a study of similar projects around the world, researchers found the displacement of traffic to be minimal. In towns and cities across the country, trial street closures are taking place to help local businesses get back up and running while facilitating social distancing. Obviously, these measures are not a panacea to poor air quality, but it does show that with a little creativity, solutions can be found that could reduce some of the worst concentrations of air pollution. Falling emissions as a result of lockdowns have brought air quality back up on the list of public priorities. The reductions may only be a short-term result, and air quality is likely to worsen as we return to business as usual. But the current awareness of what is possible should empower decision makers to create and take bolder and more far-reaching mitigation measures. The only question now is whether they have the courage.